You're listening to the HNC Let's Talk podcast, hosted by Dexter Brooks. Thanks for tuning in to HNC Let's Talk podcast. We partner with subject matter experts to provide candid conversations on health and lifestyle. Here at HNC Let's Talk podcast, mental, physical, spiritual, financial, and health are all connected. This episode of HNC Let's Talk podcast is sponsored by HealthNet Co. Together, we make insurance simple.
Hello, everyone. This is Dexter with HNC Let's Talk podcast. Today is, can you believe it, November the 24th, and we are one day before Thanksgiving. So I definitely want to wish everyone a happy Thanksgiving. But we're also in the middle of the annual Medicare enrollment period. With that being said, we definitely want to go ahead and start talking about Medicare because there's still a lot of confusion out there for people, and we want to make sure people are actually understanding how Medicare works. So today we're going to talk about Medicare Made Clear. And as you know, my name is Dexter Brooks, and I'm also a licensed broker agent, licensed in 15 states. Some carriers, I only am licensed in 12 states, but we're going to get started on the Medicare Made Clear here. So first, let's say I'm here to personally help you find a plan that best fits your needs. I know that Medicare can be confusing, and I know all the plans within your local areas within 15 states. So we're going to actually go over Medicare Made Clear, and today's agenda is going to be understanding your Medicare choices, eligibility and enrollment, the advantages of Medicare Advantage Plan, prescription drug coverage, 2022 Medicare Advantage Plan information on a high level, and the assistance that as a broker we can provide to you. So let's get started. First, we need to understand the Medicare choices. As you age into Medicare, you're basically enrolling into the original Medicare, which is Part A. Part A on the original Medicare is that red, white, and blue card, and Part A helps pay for hospital stays and inpatient care. Now, Part B helps pay for doctor visits and outpatient care. Now, you must be aware that Part A is free and Part B does have a cost. So when you're aging into Medicare or you're disabled and you receive Medicare, you have to actually elect or select to enroll in Part B. Okay? So it's not something that's just giving to you like your Part A. Now, after you enroll in original Medicare, there are two ways to get additional coverage. Your first option is to have or to add a supplemental policy, which is considered as Medicare Supplemental Insurance or gap insurance, which help pay some of the out-of-pocket costs that come with your original Medicare. However, you also have to include a Part D plan. Part D is considered as your prescription drug coverage, and it is offered by private companies. So you have to realize now you have an original plan, which is a Medicare original, your red, white, and blue card, and you choose to go with the supplemental policy, which is a Medicare supplemental policy, or you can call it a gap plan. And you also are required to pick up a prescription drug plan, which is Part D. Your other option is option 2, which is Medicare Advantage Plan. Now, Medicare Advantage plans are offered by private companies, and they're called Part C, which combines Part A, your hospital insurance, and Part B, your medical insurance, in one plan. And they usually include prescription drug coverage, which is Part D. And they also may offer additional benefits not provided by your original Medicare. And to be eligible for these plans, you're eligible for original Medicare Part A and B if you're at least 65 years old or you're under 65 and qualify on the basis of a disability or other special situation, and you're a U.S. citizen or a legal resident who has lived in the United States for at least 5 consecutive years. Now, most people ask, when can I enroll or when am I eligible to enroll? In the beginning, you have what we consider as your initial enrollment period. Your initial enrollment period is 7 months long. It includes your 65th birthday month, plus 3 months before and 3 months after. It begins and ends 1 month earlier if your birthday is on the first of the month. However, you may enroll in Part A and B or both. You may also choose to join a Medicare Advantage plan, which we call Part C, or a prescription drug plan that is called Part D. Although you are not required to enroll in Part D, there is a penalty of 1% of the average monthly premium for each month you delay enrollment. So let's talk about the eligibility and enrollment. Currently, we're in the annual enrollment period. That period is from October the 15th through December 7th. During your annual enrollment, you can add, drop, switch your Medicare coverage. Now in January, we have another open enrollment period that's called the Medicare Advantage Open Enrollment Period, which is January 1st through March 31st. So if you're already a Medicare Advantage plan member, you may disenroll from your current plan and either switch to a different Medicare Advantage plan, which is a one-time only, or go back to your original Medicare during this period. And when we say original Medicare, we're speaking about the red, white, and blue card, okay? We're not talking about the Medicare Advantage. So again, during the open enrollment period, which is January 1st through March 31st, if you're already a Medicare Advantage plan member, you may disenroll from your current plan and either switch to a different Medicare Advantage plan, which is a one-time only, or go back to your original Medicare during this period. Now, there are also other opportunities to enroll, which is considered as special enrollment period. Depending on your certain circumstances, you may be able to enroll in a Medicare plan outside of the initial enrollment period. Now, remember, the initial enrollment period is the time when what? Is the time you are aging in. So that basically means when your 65th birthday. That's the initial enrollment period. So on a special enrollment period, depending on circumstances, you may be able to enroll in a Medicare plan outside of that initial enrollment period or annual enrollment timeframes. Some ways you may qualify for special enrollment periods are as follows. You retire and lose your employer coverage. You move out of this plan service area. So you basically move into a different zip code, different location, different state, or you qualify for extra help. And we're going to touch base on that a little bit later. Or you have been diagnosed with a certain qualifying chronic health condition. So this gives you the opportunity to have a special enrollment period where you can change your Medicare plan. Now, let's take a look at some of the advantages of Medicare Advantage when it comes to benefits and features. Under original Medicare covers for hospital stays, covers for some medical care like doctor's visits, and preventative services like flu shots. However, there's a list of things that original Medicare don't cover. But you also have to remember that Medicare Advantage also covers hospital stays, covers for some medical care costs like doctor visits, preventative service, plus prescription drugs, routine vision coverage, routine hearing exams, and hearing aid coverage. And it also has a limit, which is on your annual out-of-pocket costs. Now, there's 10 things you need to know about Medicare Advantage. Number 1, you must continue to pay your Medicare Part B premium. Number 2, Medicare Advantage has you covered. Number 3, joining a Medicare Advantage plan may affect your current coverage, and I'll explain that. When we say it may affect your current coverage, it's because if you are enrolled into an original Medicare, you now have the Medicare Advantage. So you're picking up more benefits. Number 4, it's always best to use a network provider. And number 5, you may qualify for financial assistance. And number 6, if you enroll in Part D, which is prescription drug coverage, you may pay a penalty if you enroll late. So make sure that if you're going to enroll in a Part D plan, that you enroll timely. Do not omit enrolling, because there's no reason for you to be paying a penalty if you enroll in a timely fashion. Number 7, a Medicare supplement insurance plan, which is also called a Medicare policy, is not a Medicare Advantage plan. Number 8, keep your member ID card handy. Number 9, Medicare Advantage offers the same protections as original Medicare. And it's surprising how many people don't realize that Medicare Advantage offers the same protections. Because you have to realize that Medicare Advantage plans has to follow the same rules and guidelines as original Medicare. These plans are being approved by CMS, the Center for Medicare Services, who also approves the original Medicare plan. So they have approved these plans, so they have the same protection. And number 10, you have a built-in financial safety net when you enroll in a Medicare Advantage plan. Now let's take a look at something that's really important, and that is your prescription drug coverage. But before we begin, we want to make sure we take a moment to give we have to do our commercial break for our host. So we're going to definitely get that into this play here. 1 second. Let me get that started. And we're going to pause. All right, this is Dexter, and we're back here. We're going to do our commercial break. Are you thinking about Medicare insurance coverage? Navigating Medicare and all of its coverage options may be confusing, but it doesn't have to be. That is where HealthNet Co-Insurance Agency come in. HealthNet Co-Insurance Agency is authorized to offer AARP registered Medicare plans from United Healthcare Insurance Company. They are committed to providing you with personal, knowledgeable service to help you better understand Medicare and your coverage option. There are a variety of competitive plans that may meet both your needs and your budget. As a licensed insurance agency in 12 states like Colorado, Georgia, Texas, and more, HealthNet Co-Insurance Agency will be happy to meet with you one-on-one, in person, or through video conference, or over the phone to discuss your unique healthcare coverage needs and help answer any questions you may have. Don't delay another day. Contact HealthNet Co-Insurance Agency at 1-833-444-4139 so they can help you decide on a plan with confidence and discover what makes AARP Medicare plans from United Healthcare a great choice for you. That's 1-833-444-4139. United Healthcare Insurance Company, or its affiliates pays royalty fees to AARP. AARP is not an insurer and does not employ or endorse agents, producers, or brokers. AARP encourages you to consider your needs when selecting products and does not make product recommendations for individuals. All right, we're back. So let's go ahead and continue on with that prescription drug coverage. Understanding Medicare drug payment stages. Your prescription drug cost changes during the year. Depending on which payment stage you're in, the stages start over on January 1, and the dollar limits can change each year. The coverage limits are determined by benchmark sets by the Center for Medicare and Medicaid Services, which, as I mentioned before, is CMS. So the first payment stage is the annual deductible. So normally, under the annual deductible, the member would pay 100% until you reach the plan deductible. Now, some plans may have zero deductible, some may have a deductible, but that varies by plan. After the annual deductible, we end up in the initial coverage stage. Now, during the initial coverage stage is when we pay a copay. We pay copay or we pay co-insurance. During this time, the plan, which is the Medicare Advantage plan, the balance after the copay, they will pay the balance after the copay and the co-insurance. Okay. So during the stage limit for 2022, the total drug cost reach must be $4,430. That's during the initial coverage stage. So basically, we have to reach $4,430 before the plan reaches to the gap stage or with the donut hole. Now, I'm sure everybody's heard of the donut hole before, and it's always been confusing. So just remember, we have the annual deductible, we have the initial coverage stage, and then we get the coverage gap. Now, once you get to the coverage gap, 25% of your drug costs, that's what the member pays, is 25% of your drug costs. The plan, which is considered Medicare Advantage, will pick up 5% up to 75% until you reach that total out-of-pocket cost, which is $7,050. Now, I know these dollar amounts sound pretty high, but you have to remember that these dollar amounts are not something that you're paying yourself that you have to reach. There's a combination of that, which is considered as the co-pays, the co-insurance, as well as the amount of the cost of the prescription retail costs before insurance pay anything, okay? Now, once you reach the coverage gap, you will then be at the catastrophic stage. So that's the payment stage, the catastrophic coverage stage. During this stage, most members will only pay $3.95 copay for generic drugs, including brand name drugs, treated as generic, and $9.85 copayment for all other drugs, or 5% coinsurance for all drugs, whichever is greater. Okay. Now that can change based on the plan, based on the insurance company, but the standard is $3.95 copay. But also during this time, the plan pays 15% when we're in the coverage gap. Now remember, catastrophic coverage, everybody don't reach that stage. Most people just end up staying within the initial coverage stage because they're not taking that many medications. And some medications are very inexpensive. And as we get older, a lot of seniors are all taking the same medication, so they're very inexpensive. And some may have higher costs, and those higher costs are due to conditions that we have as individuals. So remember, we have the annual deductible stage, the initial coverage stage, the coverage gap stage, which is the donut hole, and the catastrophic coverage stage. And once we get to that stage, we're basically in that stage through the end of the year. And again, remember, we all do not reach the catastrophic coverage stage. Some of us never reach the coverage gap. It all depends on how much medication we have, how many prescriptions we take a day, the cost of those prescriptions, and that's why a broker is necessary to discuss these options with you so you can see the cost. Because in a lot of cases, there's no cost. So let's continue to talk about the prescription drug. What's the difference between total drug costs and out-of-pocket costs? Total drug cost is what you pay for prescription drug each year, plus what the plan pays, which does not include your premium. And let's talk about the out-of-pocket drug costs. The out-of-pocket drug cost is the total amount you pay for prescription drugs, including your deductible and any discount paid by drug manufacturers while you're in the donut hole. However, it does not include what the plan pays or your premium. Now, we mentioned that extra help. And you can also get extra help. You can get extra help from Medicare with your Part D costs. So you have to ask us, your broker, your agent, how the Part D deductible and coverage gap apply to you. So if necessary, we can reach out and submit a request to get extra help with your Medicare Part D. So let's talk about the prescription drug coverage in the pharmacy network. Basically, the pharmacy drug list and formulary. So that there's options that you have with your prescriptions. You can basically pick it up from a retail pharmacy. You can do mail order. But most importantly, when you have a plan, you want to make sure you're going to the pharmacy that's within the network of your plan. Because you have to remember that all plans are not created equal. All pharmacies are not created equal either. So let's just throw that out there. So remember, there's a drug list formulary. So on those formulary, there's a tiered formulary. So you normally have a tier 1, tier 2, tier 3, tier 4, and tier 5. And tier 1 is usually your preferred generic drugs. Tier 2 could be your generic drugs. Tier 3 could be preferred brand name drugs. Tier 4 could be non-preferred drugs. And tier 5 could be your specialty drugs. And when you reach those tier 3, tier 4, and tier 5, those are your most costly medications, okay? Because first of all, they're brand name, they're non-preferred, or they're specialty. So they really do cost a lot. Now we're going to talk about the prescription drug coverage and step therapy. Now, a lot of times people have to go through step therapy, and step therapy is basically offered to lower the cost of drug that can be treated with the same medical condition as your current brand name drugs. So in a lot of cases, you may have found that your doctor may have prescribed a medication, and then all of a sudden the insurance company comes back and go, well, there's 3 other drugs that does the same thing. So they're going to reach out to you and say, hey, have you taken this medication before? Have you tried this one? Because it works the same. So that's a step therapy. So they want you to try that other medication because it's lowering costs, it's going to save you money. And if it does not work, then they will probably approve the medication or the drug that the doctor prescribes specifically, that specific brand name or the specific type of drug, versus going through the step therapy. But you have to be able to make sure that you're able to prove, if you've already taken that drug before, that you can prove it. That's the most important thing. Now, there's also what we consider as, under the prescription benefits, is quality limits. Some drugs have quality limits, where the plan will cover only a certain amount of a drug for one copay or over a certain number of days. The limits may be in place to ensure safe and effective use of the drug, okay? And normally, these are drugs that are considered as controlled substances, like opioids. Opioids is a controlled substances. So basically, that drug will require a quantity limit. So you're not going to be able to have 90-day supply of that versus whatever is required. Also, let's talk about prior authorization. A lot of drugs may require prior authorization. Basically, that is, before the plan will cover certain drugs, it may need more information from your doctor to make sure the drug is being used correctly for a medical condition covered by Medicare. You may be required to try a different drug before the plan will cover the prescription drug. So that's the prior authorization process. It's not a very lengthy process. It's very short sometimes. So that's one of the process that goes with the prescription drug coverage. So you have the step therapy, you have quantity limits, and you have prior authorization. So just remember those. Also, remember, you can always ask for an exception. If you need a drug that's not currently covered by your plan, you may ask the plan to cover your drug even if it's not on the drug list. This is known as a formulary exception. ask to waive coverage restrictions or limits on your drug. This is also known as utilization exception. So these are options that you have as an individual when it comes to your medication. So we all like to make sure we're in control of ourselves. And this is one of those ways an insurance company give you that control by requesting an exception, okay? So just remember that these are considered as an exception from the formulary, so that you would need to definitely make sure that you put that in writing, send it to the insurance company, and ask your doctor to sign up on it. So coverage decision, if your doctor has submitted the exception request on your behalf, generally most plans or most insurance companies will make a decision within 72 hours. Sometimes that can vary by carrier. And you can also request that it's expedited or fast decision if you or your doctor believe your health requires it. Okay, so that's something we as people, as seniors need to remember, that you do have the option to request for an exception for a drug. So again, we know there are a lot of information out there going on about the Medicare within 2022. We see this every year, a lot of information. I get a lot of questions. And the main question I get all the time is that one good question. I saw this on television and I saw XYZ person. This person was talking about I can get $140 back. Or you saw the commercial, well, I got $4,000 back in my Social Security. You need to realize that there are cases and situations where that will apply, but that doesn't apply to everyone. So you want to make sure you reach out to your broker, reach out to your local broker, reach out to your broker, reach out to a friend who has a broker and ask them these questions. Before you decide to dial that number, call a friend. Reach out to that friend, ask that question, say, hey, I'm on Medicare. I saw this commercial and I want to find out more information. Do you happen to have a broker that you know of, somebody that you trust? Because that's what it's going to take for you to make sure you get the correct answers. We have got to make sure that we are focusing our energies on protecting the seniors. And to do that, we have to make sure seniors are receiving the most honest information and not information that's misleading. Okay. So that is also one of my key P's, because I see that a lot. I get that question a lot. At least 80% of the time, I get that question, and most times the case is no. And it just depends. It depends on circumstances. It depends on location. It depends on zip code. There's a lot of factors that play into that. But you have to also remember that Medicare Advantage offers more benefits than original Medicare. A lot more benefits than original Medicare. And in order to receive those benefits, you as a person will need to make sure you're communicating with your broker. You're actually talking to them about your situation, what your needs are. And that's what we call a needs assessment, so that broker can actually give you their correct information. Because if you're not providing a complete detailed needs assessment, then you may not be enrolling into the correct plan. You may have a Medicare Advantage plan, but there may be a better plan that gives you more benefits than the one you have. So that is important. So if you have any questions about Medicare, original Medicare, Medicare Advantage, Medicare supplemental policy, don't hesitate to reach out to us. I'm Dexter with HNC Let's Talk Podcast. I'm also a licensed broker in 15 states. Our toll-free number for Medicare Advantage plans is 1-833-444-4139. Again, that's 1-833-444-4139. If you have questions, don't hesitate to reach out to us to ask those questions, because we want to make sure everyone is aware what is available to them, because there's a lot of miscommunication going on, and we want that miscommunication to be at a lower level so that our seniors are receiving the best option that's available to them. So on that note, we're going to go ahead and end this short podcast. And I want to thank everyone for listening today. And again, this is HNC Let's Talk Podcast. And again, my name is Dexter. And I hope everyone have a great Thanksgiving. Take some time to spend with family and friends. It's been a long road back to this place where we are today because of COVID. Things are still not cleared up as we thought they would be right now. So we're going to ask that you also be safe and conscious of other people around you. And again, this is Dex with HNC Let's Talk Podcast. Have a great day.
You're listening to the HNC Let's Talk Podcast, hosted by Dexter Brooks. Thanks for tuning in to HNC Let's Talk Podcast. We partner with subject matter experts to provide candid conversations on health and lifestyle. Here at HNC Let's Talk Podcast, mental, physical, spiritual, financial, and health are all connected. This episode of HNC Let's Talk Podcast is sponsored by HealthNet Co. Together, we make insurance simple.